Good morning everyone. In this video, let's discuss about water balance and also about electrolyte balance. Water makes up about 60% of the total body weight, playing a very important role in cellular functions. Let's try to understand the difference between osmolarity and the osmolality. Osmolarity is the solute concentration in 1 liter of solution, whereas osmolality is the solute concentration in 1 kilograms of solvent. So both of these will help in maintaining the balance of fluids across the cell membranes. Now let's understand the hormones that are involved in regulating the water balance in the body. Aldosterone is secreted by the adrenal glands, which will promote sodium and water reabsorption in the kidneys, and they'll also facilitate potassium and H plus ions excretion out of the body. Next is the vasopressin or the antidiuretic hormone, which is released by the posterior pituitary, and they are going to increase the water reabsorption in the kidneys by specifically acting on the distal convoluted tubules and the collecting ducts of the nephrons. Next is the renin. It should be noted that renin and the renin with double N are both different. Renin with a single N is a hormone produced by the kidneys to regulate the fluid balance in the body, whereas the renin with double N is a digestive enzyme seen mostly in the stomach of infants involved in curdling of the milk. Next is the natriuretic peptides, which are released by the heart in response to increased blood volume. So they are going to promote sodium and water excretion out of the body to reduce the blood pressure. The renin-angiotensin-aldosterone system, the RAAS, are of utmost significance in the body. So this system gets activated by a drop in the blood pressure or due to low sodium levels in the body. The kidneys are primarily going to produce a hormone called as renin, which is going to convert the angiotensinogen produced by the liver to angiotensin 1. And then this angiotensin 1 is further converted to angiotensin 2 by the angiotensin converting enzyme ACE produced by the lungs. And then this angiotensin 2, which is just now formed, is going to narrow down the blood vessels to increase the blood pressure, and also they are going to stimulate the adrenal glands to release aldosterone, which is going to promote sodium and water reabsorption in the kidneys, and thus the blood pressure and the volume goes up. And then angiotensin 2 will also stimulate the thirst centers in the brain, and they'll also release the vasopressin, which is going to promote water retention in the body. Inhibitors of this ACE enzyme is given to patients with hypertension and heart failures, because the angiotensin 2 formation is blocked, leading to vasodilation and reduced fluid retention in the body. Now let's move on to the electrolyte balance. Electrolytes like sodium, potassium, chloride and magnesium are very important in the body because they are involved in nerve impulse conduction, muscle contraction, and also for maintaining the acid-base balance in the body. Imbalance in these electrolytes will cause muscle weakness, cramps, heart arrhythmias, and neurological symptoms like confusion or seizures. Now talking about dehydration, which is a condition that occurs when water loss is going to exceed water intake. Types of dehydration includes your isotonic contraction, where equal amounts of water and sodium are lost from the body, as seen in case of diarrhea. And then hypotonic contraction, where the sodium loss is more than the water loss, leading to less sodium levels in the body. Example, it is seen during the Addison's disease, where aldosterone deficiency is seen. And then in the hypotonic contraction, the water loss exceeds more than the sodium loss. So this is going to lead to increased sodium levels in the body. Example, it is seen in the diarrhea, vomiting, severe sweating, and also in diabetes insipidus. Next, moving on to overhydration, which is caused due to excessive fluid intake or fluid retention in the body. The types of overhydration include your isotonic expansion, which is the retention of fluids and sodium in the body, as seen in case of edema. And then the hypotonic expansion, which is caused due to excess water. All the excess water in the body is going to dilute the electrolytes. So that is going to cause hyponatremia or reduce sodium levels in the blood. Next is the hypotonic expansion. The sodium gets retained with elevated plasma osmolality in this type. The extracellular hypertonicity may lead to brain cell overhydration, leading to coma and also death of the individual. Now let's see the clinical significance of electrolyte imbalance. The high sodium levels in blood is called as hypernatremia, which is caused due to water loss and high sodium intake. Symptoms include thirst, restlessness, and coma. Next is the low sodium levels in blood called as hyponatremia, caused due to excess water intake and consumption of drugs like diuretics. Symptoms include nausea, seizures, and confusion. Hypokalemia is the condition where potassium levels are low in the blood, caused due to diuretics, consumptions, and vomiting. Symptoms include muscle weakness and arrhythmias. High levels of potassium in blood is what we call as hyperkalemia, caused due to renal failure, tissue necrosis, and burns, and symptoms include palpitations and cardiac arrest. Next, high and low levels of chloride ions in the blood is called as hyperchloremia and hypochloremia respectively, and these are linked with acid-base imbalances, and they're going to affect the pH regulation and hydration status of the individual. Low magnesium levels and high magnesium levels in the blood are called as hypomagnesemia and hypermagnesemia. They impact muscle functioning and heart rhythms. Common tests for fluid and electrolytes assessment include your assessment of serum osmolality to assess the hydration status of the individual, and the electrolyte panel like the sodium, potassium, chloride, and when bicarbonates are also checked in serum. And then sodium and potassium excretion in urine is also tested to evaluate the kidney function and also how the electrolytes are handled by the kidneys. So this is all about water and electrolyte balance. Thank you.